see if it comes up. Again, thank you, Judy. I am going to go ahead and let you get started. It's just 12:03 now. So thanks for joining us today. I'm really interested to hear the rest of this presentation. I saw some of the updated numbers and I thought it was really important to share that on. So thank you so much for coming, and I will pass it over to you.
Okay, great. Well, thanks, Katie, for inviting me to present this afternoon. Wanted to share some information from some reporting and some, I guess, research that has been done on some surveys, and just to share what we kind of know, what some of our kids are experiencing during the pandemic. So I'm going to start, well, on the first screen here, this is how you can get a hold of me if you need to. My name is Judy Rapias, for those of you who aren't familiar with me, and I do work with NAMI South Carolina, and I am the Ending the Silence Regional Program Manager. So, and again, that's how you can get a hold of me, my email and my phone. But I want to share some information about kind of what we knew prior to COVID starting, about our youth and mental health. So we knew typically that there was about 20% of our youth that were dealing with a mental health condition. And that, you know, half of the cases begin by age 14, and then 75% of the cases begin by age 24. So our teens, it's really important that we notice in those years certain symptoms and things that can happen in that time. So it's really important that we are, you know, paying attention to our youth, and also talking to our youth about their mental health. We also know that our LGBT youth are really, you know, we're always struggling before that. They've had a lot of sadness and hopelessness. I'll talk a little bit about some of the things that we have found out over the past year, because that is one group in particular that has really struggled during the pandemic. And then also we know that a high percentage of people that die by suicide, you know, had an underlying mental health condition. Okay, so this is pre-COVID. So some of the stuff that we found since COVID has started, there was a research, or I should say actually a survey done by the 4-H Club in conjunction with the Harris Poll. And these are the statistics that we found from that particular survey that was done last summer. And then I got a little bit more information from Mental Health America, which seems to actually confirm what this particular survey that the 4-H Club did. So our youth were indicating, 7 in 10 of our youth were indicating that they were experiencing struggles with their mental health, you know, more significant struggles. So, you know, that's up from what we were noticing, you know, pre-COVID. And they were reporting that these were the various things that they were really struggling with. You know, it was anxiety, an increase in anxiety, excessive stress, depression, you know, increasing their loneliness. This was really interesting to us at NAMI, that 64% of the teens believed that COVID would have lasting effects on their mental health. And again, the Mental Health America survey that was done of youth, it was done in November of 2020. It really reaffirmed these statistics. We will also know that like I said, there's certain populations that were struggling more so than those of their peers, like our LGBTQ, were very hard hit because of the loss of their social connections. A lot of them don't have, you know, home lives that are affirming for them. So anyway, they're struggling more so. And then also, because of the disruptions of COVID, our Black and Indigenous and people of color were, you know, disproportionately affected as well with their mental health because of some things like, you know, job loss, maybe more people that have lost jobs or their lives. So again, all those folks are struggling, maybe even more so than their general peers. So what our youth were actually saying to us is that their schoolwork was making them most stressed. This was very eye-opening to me to read this next one about the 67% of our students were feeling pressure to keep their feelings to themselves, and they were pretending to feel better, not to worry anybody. So this is very concerning to me. So, you know, it's really important that we really have conversations, because we want to make sure that they are telling us what's actually going on, because we really want to help them if they are struggling. So again, though, you know, there's some opportunities. This isn't all bad news. You know, our teams see an opportunity during this time of COVID. 70% wish their schools taught them more about mental health and coping strategies. And 79% wish there was an inclusive environment or space for people to talk about mental health. So I want to just add a couple of things about this, because again, the Mental Health America study report that they just put out a couple months ago reaffirmed all this, but I took a little bit more from what Mental Health America found, and is that we really need to include our youth in solutions surrounding mental health, because our young people are saying some things that maybe we need to pay attention to, and really and be involved in these solutions. And one that they see is that if they were able to take more mental health breaks from some of their schoolwork, or maybe even some absences because of their mental health struggles, it would be very helpful to them. And so, you know, again, something to think about. And we also need to include our youth and ask them, how do, you know, how can we support their mental health? And I don't think we do that enough as adults. They also reported what was helpful for them is really hobbies was like the #1 thing that is really helping them deal with their mental health. Their friends, obviously, we know that friends and family can be like the strongest supports for individuals that are struggling maybe with their mental health. And then I found this very interesting, is that they said their social media was extremely helpful, again, because being isolated, I think, you know, that was one way that they could connect with their friends. So why does it matter that we, you know, talk about mental health? 50% of our students will drop out of high school that have a mental health condition. So that's way too high. So we're not addressing some needs there. This one is very disheartening to me, because so many of our youth that are in the juvenile justice system have a mental health condition. And a lot of times they're not being diagnosed until they're in the system. So if we can catch some of those children, you know, upstream before they get to that point, you know, that would be really helpful. Suicide is the second leading cause of death for our youth ages 10 to 24. A harder statistic for me to say is that suicide is the #1 leading cause of death for our children between the ages of 10 and 14 in South Carolina. So that's, you know, again, that's just unbelievable. You know, we have to figure out a way to prevent that from happening. And then again, about, you know, the fact that a lot of people that die by suicide had an underlying mental health condition. And, you know, for our youth, it's 90% of them had one or more mental health conditions. So just some follow-up on suicide in our youth. There's been a 56% overall increase in the years between 2007 and 2017, driven mostly by the increase in our Black youth. As you see there on the left-hand side, 73% increase among our Black youth between 1991 and 2017. So our Black youth are really driving the suicide rate up. And so that's just, again, a population that we really need to assist. And our Black males are less likely to report thoughts of suicide, but more likely to attempt. And this is something else that, overall 17% of our suicides of our students seriously consider suicide within a given year. And this was pre-COVID. I can tell you that the CDC has said since the pandemic is that there's been that it's 1 in 4 of our youth that are contemplating suicide. So that's up, so it's 25% of them are thinking about suicide seriously. Here's a really interesting fact about the amount of emergency room visits over COVID. 31%, there was a 31% increase in emergency room visits for mental health conditions for our youth between the ages of 12 and 17. So again, there was a lot of things going on. We heard some of that anecdotally, but now we have some real numbers from the CDC that confirms that. And again, our transgender and non-binary youth, we're thinking about suicide. Over 50% of them have thought about suicide. That number is greater than that, I'm sure, with the pandemic. And same thing with the LGBTQ youth. 40% of them are thinking about suicide within the last year. So again, we know that's a little bit higher from pre-COVID. I mean, these are pre-COVID numbers, but we know it's a little bit higher now. Again, the biggest thing driving that is the fact that, they're in non-affirming life situations, and that's very difficult for them. So our vision at NAMI South Carolina, we came up with this at the beginning of the pandemic because we knew that we needed to change, how we were thinking about mental health. So we believe that everybody, well, it's true, everybody does have mental health, and that we all struggle sometimes, and that there are tools and coping skills available to us to deal with anything from stress to an actual mental health condition. And so we know that with the advent of the pandemic, everybody was experiencing stress, extra stress. And so it was really important that we all had some type of healthy coping strategy to help us deal with what was going on. Because let's face it, we were trying to respond to an abnormal situation with like normal coping strategies, and they weren't always working. So it was really, we had to be really vigilant about our mental health. So NAMI has these mental health awareness programs called Ending the Silence, which I am the program manager for. And just to give you some overview of what they are, we have 3 different ones. We have one for students, we have one for our school staff, and we also have one for families that we do for free in the community. And we've partnered with a lot of the schools in the area to do these particular presentations. So our student presentation is about 50 minutes long, and it's for middle and high school students, and it helps to raise awareness about mental health conditions, but we talk a lot about the warning signs and how, we need to break stigma. We give them some references as far as the number of people that are dealing with a mental health condition, because a lot of times they don't realize how common it is. And then also we discuss if they are concerned for themselves, how they can get help, who they need to reach out to, and stressing the fact that, they need to reach out to a trusted adult. And then we also do discuss suicide, and what warning signs look like and how to reach out for help as well. So we're providing a lot of information surrounding, mental health. We do cram in a lot of information. And then lastly, though, the best part of the presentation is that we have a young person that shares their story of dealing with a mental health condition. So it puts a face to, mental health conditions and mental illness. The program that we do covers the comprehensive health standards for middle and high school. So a lot of things that they're supposed to be learning in school about mental health. And so some of the examples include, the positive coping strategies, exploring resources, how, what kinds of things are out there for crisis management for their mental health, how to ask for assistance. Then we talk about, the warning signs for anxiety, depression, and suicide. So we go over all these things plus so much more. But again, these are things that they should be learning in school anyway through their health classes. Ending the silence for school staff. It really, it contains a lot of the same information that we talk about in the student one, but it gives information on how to maybe approach a student and how to work with their families. We're not asking people to be diagnosticians. We're not asking school staff to, diagnose students, but we do want them to know what some of the warning signs are and how they can reach out to families and students if they are noticing that they are struggling, that a student might be struggling. And then we also have a program for families. And it goes over a lot of the same things, but a little bit different. We try to provide information about how to approach your, child, how to work with school staff, giving ideas about that. The nice thing too about the families and the staff, we always do follow up with a young adult telling their story, so that people have some sense of hope, because sometimes, it can be a little down. We can get a little down by hearing some of these things, but when you hear somebody's story of hope, it really does, encourage people, for the future, because there's a lot of people. This is the thing. There's a lot of people, including celebrities and sports figures, that are dealing with mental health conditions. And so it's important that everybody knows that we're not alone, and it's more common than you think. Some supplemental programs that we have to our staff and family presentations are what we call Refresh and Reclaim. So it's a boundaries and self-care workshop. So we talk about what might be our barriers to setting up healthy boundaries, and what might keep us from practicing self-care. And we have found during the pandemic that it's really important that everybody has a way to practice some type of self-care for themselves and to be conscious about it. Self-care doesn't always have to be about getting your nails done or getting a massage. It can be as simple as, drinking a cup of coffee and sitting on the porch and just drinking your coffee and having a moment to yourself, so it's really important that we take those times for ourselves. And we have a parent portion, and we also have that first one was describing the staff one, and then we have a parent refresh program that's very similar, but we do go into some communication skills as well, to get folks to understand that it's really important that sometimes we have to communicate some of our boundaries and some of the things that are important to us. But it's important for us to refresh ourselves. So just a little bit of information about the Ending the Silence program outcomes. We've spoken to a lot of individuals, especially this past year. As you can see that in the middle there, it's talking about just this past couple of months, really since April. We had gotten in front of 17,851 individuals. That's for all of our programs. I will say that's probably a good portion of those are our students. And then that was done in like 287 presentations. And I can tell you, we were working very hard and we were very tired at the end of April. And we didn't really slow down in May either. So we were happy to, speak to students and families over the past month as well. So I'm very proud of the fact that since 2017, we've spoken to over 72,830 individuals, and we've done 1,504 presentations. And this is across the whole state. It's not just in our local area, but we have done quite a few as well in our local area, but this is across the whole state of South Carolina. I'm going to actually skip this, but I did want to just point out one thing. When we are doing our presentations, we started collecting some information when we were doing them live. We were asking a question about suicide, and approximately 25% of the students that when we ask if they've had some experience with suicide, approximately 25% of them had some type of interaction surrounding suicide. And that has really held true doing our virtual presentations as well. Just some feedback that we've gotten from families that have seen the program. This long one here, really important. I'm so thankful that our school's finally talking about mental health issues and trying to educate parents, students, and school faculty to help alleviate some of the stigma and ignorance, on the subject. So, yeah, a lot of times we're trying to set the facts straight because there's a lot of misconceptions about individuals that live with a mental health condition. Feedback from the students. This is always my where my heart skips a beat sometimes, because some of the stuff that they say is just so tremendous. They have such wonderful feedback and some great ideas. I have taken a lot of ideas from students to improve our presentations over the past couple of years. They have a lot of great ideas. But I'm going to say overwhelmingly, the feedback that we have gotten has been just tremendous, just from the fact that they're learning the warning signs and that they feel like this is a safe, inclusive environment, really, to talk about mental health. A lot of times, we get feedback that they've never had a conversation, an honest conversation about mental health. So they love the fact that we're starting to talk about it with them. This one from school staff, I'm going to read the first one because this one was like, okay, yeah, they were really paying attention and getting the message, but reminded me to put a student's mental illness on the same level as physical illness. So yeah, we're trying to make sure people understand that, mental health should be viewed no differently than physical health, because really mental health is health. And so if you had diabetes, you're going to take care of yourself. If you have something with your mental health, you need to take care of your mental health, just like you would your diabetes or your asthma. Just want to talk about this one program that we're working with coming, gosh, I can't even say it. We have this pilot program that we are introducing to the state. So we're just doing several schools locally, but it's a mental health awareness night through football. September is Mental Health Awareness Month, Suicide Awareness Month. And our goal is to really start the conversation to normalize mental health. We've partnered with the Hayden Hurst Family Foundation. For those of you who aren't familiar with Hayden Hurst, he is a tight end with the Atlanta Falcons. Zelensky's Hope, you might be familiar with them. And then another organization called Same Here Global. And NAMI is going to work with these organizations to do the awareness program at a particular football game. And parents will also be encouraged to attend an upcoming presentation to learn about mental health. And we're going to also be asking students to sign a pledge to watch a video about how they can become a lifesaver. So they can be a lifesaver maybe for themselves or somebody else surrounding suicide. We're always looking for people to get involved with our programs, to become presenters, either a young adult person or maybe another adult that has experience with their own mental health issue, or maybe they have a loved one that has a mental health condition, and to share with students. You can always get in touch with me or Katie if you're interested in getting involved with NAMI that way. We are all on social media. We're on Twitter, we're on Instagram, and then we are also on Facebook. So those are some ways that you can get in touch with us on social media. And I just want to end with giving some information about NAMI's structure, because I know Katie's going to talk a little bit about the local affiliate, but we have NAMI National. It starts up there, the national level. Then we have each state has their own NAMI organization. So each state in the country has their own organization. I work for NAMI South Carolina. And then each state has different affiliates that roll up to the state. NAMI Piedmont Tri-County is one of those affiliates, and that's where Katie comes in. And so I'm going to turn it over to you, Katie.
Great. Well, thank you for that. And we're going to go to the questions and answers. I'm going to make my piece very brief. We just wanted to share some information about NAMI Piedmont because somebody actually said to me the other day, they had somebody come into their office and they were talking about their children's mental health, and they said, you know, there is just nothing here. And she said, but I know you are here, but I didn't really know what to tell her. And it's like, that's where we have to get the message out that we have these programs available for free to the community in Chester, Lancaster, and York. So NAMI Piedmont Tri-County has been here for 26 years. We have the drop-in center that just opened, and we were so happy to see a lot of you at the open house that we had on Friday night. But the drop-in center is open by appointment only until all the COVID restrictions are lifted. But then we're going to be running a lot more of our programs and social groups out of here. And so we're here right next door to Winthrop University, right down here in Rock Hill. And the telephone number and everything has stayed the same. You can find that on our website at namipiedmont.org. So this is the drop-in center. This is our community space. It's going to be offering safe, supportive, and normalizing environments for people living with a diagnosis of mental illness and the people that love them. So we'll have all these different programs available, including social groups. This is not a space for therapy. It's not a place to get medications. It's not even a place really to talk about your mental health. This is a place to focus on relationships and personal empowerment and just being part of a community that just understands who you are and where you want to go in life. So watch our calendar, watch our social media for that. We will have our calendar and our membership applications coming up as soon as we can possibly get them. And then we also have 12 free support groups a month. We have the Connection support group for people with mental health diagnosis. We have a family and caregiver support group for those with an adult who's living with mental illness. Parent and caregiver support group for those with a child under 22 who is struggling with either an emotional or behavioral disorder. They don't have to have a diagnosis. Nobody has to have a diagnosis to attend these groups. If you are just trying to manage your child's mental health, you can absolutely come along and join those free groups. We have an LGBTQIA group for those over 18 living with a mental health condition. And we just heard Judy talk about the prevalence of suicidal ideation and suicide within that group. And so we want to encourage everybody to attend that. And then we also have a suicide survivor support group that we run with the assistance of the American Foundation for Suicide Prevention. They run that group out of our office as a co-group with NAMI Piedmont Tri-County, and you can join that and just go onto our website under the support tab, and you can go ahead and get registered for those groups. We have a bunch of other programs, our community programs. We have education classes for parents and caregivers and for families and loved ones of those with of an adult with a mental health condition. We have programs for frontline workers. We have programs for military service members and veterans, which we actually don't have a group here at NAMI Piedmont Tri-County for that, but most of our groups now from NAMI are online. And if we don't offer it here at this affiliate, we'll find an affiliate that will let you join their groups as well. We talked about the presentations, we talked about the support groups. We also do crisis intervention training through NAMI South Carolina, and we can organize that. We can be the go-between between our first responders here in Chester, Lancaster, or York County to set those trainings up. The crisis intervention training is so important. We have, and then we also have a provider training. And if anybody is interested in the mental health training as well, we could also connect you to the people that are doing the training for that as well. And then we also have a Facebook group that you're more than welcome to check out. It doesn't have its own name. You have to just search for the mental health treatment for kids and adolescents, including inpatient and residential if you look for that. Or if you just contact me, I will make sure that you get into that group. It's so important to build a community of people that are working with each other to find the best treatment for our children and adolescents. And then we're on Facebook, we're on Twitter, and then you can always find us on NAMI on Instagram. And I post everything that we're doing on Instagram. You've probably noticed if you follow us. So feel free to follow us, tag us. If you want something sent out, let me know. I will certainly get your programs and presentations out as well. We like things that help our community. It's always our goal to get that shared out. So I'm going to stop sharing my screen. I wanted to make that very brief and very quick. But if anybody has any questions for Judy or myself, feel free to put it into the chat box or into, I'm actually following it along on Facebook as well. So please let me know if you have any questions. So this information would be beneficial for our district to have. So Rock Hill Schools does have Judy come in and do some of those programs. They do the End in the Silence program in the schools all across York County. We do Rock Hill schools as well. We also do those for teachers. If you haven't managed to get one, attend one, or if you are looking for extras, then contact myself or Judy, and we'll make sure we get together with Dr. Turner and we will get those, get that presentation set up for you. We'd be happy to do that. And we agree the Refresh program is excellent. The pilot program for high school, yeah, we love that program too. That's going to be really exciting. Rock Hill is football city, they tell me. Is the NAMI South Carolina Peer Leadership Council active? Judy, I actually don't know the answer to that one. Are you still on?
Sorry, I am still on. I was unmuted.
Is the NAMI South Carolina Peer Leadership Council active? Do you know?
I don't know. I don't think it is. I haven't heard anything. I can bring it up though, to somebody that I am not familiar with. Um, but it's a great it's a great thing. I'm gonna say
I will make
yes.
sure that I ask that. If you shoot
Yeah.
me an email at info@namipiedmont.org, I will make sure that I find the answer to that question for you. That's pretty easy to find out. It's just a quick phone call, and so I will
Yeah.
figure that out for you.
Mhm.
The intervention training and others, you can call me at NAMI Piedmont Tri-County. The 803 610-8174. Did you just post that, Judy? The NAMI PLC Education and Training Committee, did you put that up?
No, Bob did.
Oh, I didn't. I can't see actually who's posted that. Well, oh, okay, now I've got it. Okay, it just came up, it just popped up. Okay, cool, excellent. We will make sure we get that posted out on our social media as well. So thank you for that, but absolutely feel free to contact me for any of these programs or contact Judy. We'll make sure that we get the information that you need. The presentation, I will absolutely be sharing the presentation. It will be on YouTube. I will get that posted out as soon as we're finished today. I will upload that to YouTube and make sure that you can see it there. And you will also get an email from us after the presentation to let you know that it's been posted. The NAMI camp on campus, yes, Judy does work with a lot of different universities and colleges, York Tech, Winthrop. We do have people coming from those locations to do our presentations as well. And so the NAMI South Carolina Peer Leadership Active, again, we'll have to get the answer to that one, but other than that, does anybody have any questions about the increasing statistics that Judy had shared with us? Or you're so welcome. Thank you for being here. We appreciate that. I'll write that. Well, I'll get that posted out as well. That will come through on the recording as well. So the NAMI PLC chair, Jeremiah at NAMI Rhode Island.org. Okay, we'll make sure that we get that out as well. When we post, I'll put that under the recording on YouTube. And yeah, so yeah, just reach out to Dr. Turner for additional programming, or go ahead and give Judy a call, and she'll make sure that she connects and talks about, you know, the request that came in. And yeah, so well, thank you, Judy. I appreciate that. It's kind of depressing, but I'm really glad that you were here to talk to us. I think it's important for us to know that those numbers are increasing, and we need to be out there stamping the pavement and making sure that we are supporting these kids with what they're requesting. And I'm going to make sure that everybody has a link to that report that Judy talked about, the 4-H report and Mental Health America. I'll make sure that we get that report up underneath as a link on the YouTube channel so that you can read that. It's super interesting. I did sit down and read the whole thing, which is what kind of prompted Judy and I to say, you know, we need to talk to people and let them know that things are changing and going in the wrong direction. We need to pay more attention and start giving these kids what they're asking for. So again, thank you for joining us. It's almost 12:45. I promised we would be off by 12:45. Do we know why the numbers are increasing? Well,
I mean, a lot of it's due to
thanks, Bill.
thanks, Bill. I mean, you know, it's a variety of things, but you know, a lot of it's due to the fact that, you know, there's increased isolation, you know, like it might be different for different populations, but like I said, for our LGBTQ individuals, you know, a lot of them have been kept from going to the environments that were very affirming for them, you know, like school. Like a lot of them couldn't go to school. So so that could be one factor. You know, the other factor is they've had multiple, some groups have had multiple traumas, you know, between losing family members, you know, job loss. It's a variety of things that the pandemic forced upon people that they didn't have to deal with before. So it's, you know, in addition to the stresses that some people already had. So
I will also add on that our therapists and psychologists and psychiatrists are overwhelmingly busy. And so where our kids were in therapy maybe once a week, now it's maybe once every 4 or once every 6 weeks. And it's become harder to find the help that they, you know, that they were relying on before. And I know that I always go back to this as well. A lot of our kids in foster care or adopted kids, we know that they have the similar statistics to the children who are LGBTQ. So we know they're 4 times more likely to attempt suicide. We know that they're 4 times more likely to end their lives through suicide. And I think that, you know, that isolation has driven them further into themselves. It's given them less resources. It's given them less things that they can kind of go out and do their sports and go to school and, you know, be engaged outside in the community. It's forced them into their rooms to kind of think about things that they don't really want to think about. And it has, you know, it's just an awful lot of stuff. It's a lot of stuff. And I think social media, weirdly, I think, do you think that has helped?
Well, that's when I was going to comment on that too, Elizabeth, because I know that one kind of popped at me, and so I've seen a couple different things about social media, and I do think that because they were isolated, that was one outlet for them. But the other thing that I have read about social media, I think there's like this sweet spot where it can be helpful, but then when it gets to be where that's the only thing that they're doing, then that's when it becomes detrimental, I guess, with a lot of things in life, right? But there is a correlation between the, you know, use and the amount of use and, you know, maybe suicide or depression. And I think that if it's over a certain number of hours per day, that's when there would be a lot of concern. But at some point, it's not a bad thing. But then, you know, and it's like you said, moderation is all right with anything, right? So
yeah, and I think that just the fear of unknown for everybody. I think that we all, you know, am I going to have a job? Is there going to be enough, you know, am I going to get a paycheck this week? Am I going to be able to keep my job? Is everything going to go back to normal? You know, and I think we have a new normal. And so in some ways, it's actually good for us because it's brought mental health to the forefront, and it's actually helped people who didn't have mental health challenges before this, maybe anxiety or depression or, you know, panic disorders. I think more people are kind of experiencing that anxiety, the isolation that may go along with that, which I think has been really enlightening for a lot of people and increased understanding and awareness for mental health. And so on the one hand, it's actually, you know, been, you know, eye-opening for people, which has helped us in the long run. So not saying that we should go through a pandemic just so that we can get the message out, but yeah, it's been an interesting change in attitudes to mental health.
I want to say something about what Mayuko, if I get your name wrong, I'm so sorry, Mayuko. But I read your comment about so much to learn through this pandemic, and it's time for us to be able to create a community and to express how we're feeling. And so I keep on going back to this one saying that this wise woman told me many years ago, but I just feel in this pandemic, it has just really kept, you know, pulled me through. And she said that happiness shared is double, but, you know, our troubles shared are halved. And so that's such a great thing to remember. So if we can share our troubles, because I know for me, if I'm really fearing something or I'm anxious about something, and if I bring it up to somebody and I just talk about it, it feels like it has just totally lost its power over me. So if we can talk about those things that bring us the most fear or the most anxiety, that can really just help to us coming up with a solution, or just having it not have the control over us that it can. So I just love that.
Okay, well, we are a little bit over the 12:45 now, but we super appreciate everybody. We'll make sure, Mayuka, that all this is on our YouTube channel, like I said, and I will take the comments and post them underneath the YouTube video as well. So make sure that we don't lose anything. But thank you so much for joining us today. We super appreciate it. We have a webinar coming up on June the 10th with Justin. Forgotten his last name actually, which is terrible, but he will be on June the 10th. I will get the emails out to everybody. If you're not on our email list, please go to our website, namipiedmont.org, and subscribe to our newsletter so that you stay ahead of all the stuff that we are presenting and offering. And we would love it if you would join us on June the 10th for that webinar as well. So thank you so much, everybody. Have a great rest of the day.